ever. Too much tension in my body.
Right up, yeah, you gotta stand there.
So, rectus abdominis, right here, it's pretty much the only muscle you'll be able to grab like that. And where I'm grabbing with my fingertips and my thumb here is right at that linea semilunaris. If I have to convince myself, go ahead and do like a half of a sit-up. Yeah, and it's right there. I can feel the outside edge of the rectus abdominis. So, we need to sink, I want your fingertips like this. So you're using the pads of your fingers. If this were the abdomen, it's like this. Not poking. And then, we need to sink down towards the vertebral bodies as deeply as we can go. And as you're sinking, you can do a little bit of this with your fingertips, very slowly, very gently, almost like a feather's falling to the ground like that. And I don't want you to wiggle like that. None of this, because you're not going to be able to do it that way on patients that are even slightly ticklish. Some people say you have to do it that way because this is the way I learned it in massage school. You have to move the guts out of the way. You don't want to pinch the larger, small. You're not going to. That's dumb. Stuff moves out of the way. It's all slippery and disgusting in there anyway. It does. It really. You squish it and it moves out of the way. That's the way we're made. Thank God we're made that way because if if my dog jumps on my stomach, I could potentially rupture my colon, and that doesn't happen. And my intestines move out of the way for the most part. I have one dog now. I'm pretty sure it ruptured my colon. I think that was her intention, though. So, sinking down with my fingertips until I feel some tissue. Which way are the muscle fibers of psoas here? Yes, pretty much straight up and down. So I can determine what muscle I'm on based on the fiber direction. I feel the fiber directions are this way. I'm probably on psoas. If I need to convince myself, push very lightly into my hand. There we go. It pushed me away. There's nothing else there that's going to push my hands out like that when we flex the hip. Psoas is the only thing that can do that. So, find a tender spot. What do I do once I find a tender spot? Have them rate it. Let's say it's a 6 or so. What am I looking for when I'm positioning him?
Half, decrease by
So
half.
by at least 3, if not more. How am I going to decrease that?
Shorten the muscles.
And how am I going to do that? That's probably the best way to do it. Psoas does a bunch of weird things up in the spine, but we're not going to be able to manipulate those movements. It's just not. It's hard to do that. So instead, I keep my pressure, flex the hip up, wait until it decreases a little bit, and then I will almost always add a little bit of rotation of the low back, because psoas will do a little bit of that if it unilaterally contracts. See if it decreases. I really kind of fish around for that one spot that decreases the tenderness by as much as it possibly can. And then what do? I hang out here until we get a release. And then once we get a release, what do I tell the patient?
Do not
Rate
do
it.
anything.
Don't do anything. Just relax.
But you don't want to keep your hand there to feel the release, or you can't.
Well, no, I can, and I will.
Yeah.
But once I get the release, I'll often say, I want you to completely relax. Don't help me move your leg at all. I'm going to try to let it down really slowly. So I'll usually need 2 hands for this. That's where I usually let it go. So I put the foot down like that. Bring the leg down like this, nice and slowly, so the patient's able to relax. I find that spot again and re-rate it. Why would I be looking at psoas?
It's usually pretty tight for people. Oh.
Not on everybody. And a lot of people hyper-focus on one tissue or another. Some people say, oh, everybody's T4 is out. Some people say, oh, everybody has a right PI. Some people say, everybody's psoas. You gonna find them? Probably. If that's what your intention is, you'll find it. And even if it's not there, you'll find it. So the psoas, a lot of people, I mean, how many of us don't have muscle tenderness anywhere in the body? I mean, theoretically, if the muscles are all healthy, you shouldn't. How many of us don't? So that's not realistic. And maybe everybody here has some tenderness in their psoas, but is it clinically important? So we want to decide why we're going to be looking here, because lo and behold, if we're looking at the psoas, because that's, as a massage therapist, I've taken classes on like the psoas. like the root of all evil. You
Maybe,
need to treat the psoas on everybody. Everybody had tender psoas this year. Like, well, maybe something here. Maybe everybody has tender psoas as well.
maybe because it's hard to access, it's hard to get to, I don't know.
Yeah, but that wouldn't be a good reason to just search for it. We'd want to have a, you know, a reason in our head to look at psoas. What would that be?
Flexion is a problem. Pain with
Con-
flexion.
Pain with flexion, that might be a reason. What else?
Interior tilted.
Yeah, maybe anterior pelvic tilt, something like that, or an AS on one side. What else? You were doing stuff.
No,
You were moving around. You weren't using your words. Yeah, low back pain might be a reason to look at it. Why not? What else?
like a functional asymmetry from one side to the other.
Yeah. What kind of asymmetry?
I don't know, like a runner who has a super tight psoas on one side might have plenty of stride that, I don't know, like that.
I'm just asking.
I don't know.
Self,
I don't
self-conscious.
know.
All right. Yeah, maybe. Right. Maybe somebody that has like, if their low back looks like it's rotated, like the whole thing, I might look at psoas because it can do that. Just look at it. But if I'm thinking psoas in any of those, what could I also do? See if that's actually true, rather than just poke at it and say, oh, it's tender, it must be true. Range of motion. How would I test the length of the psoas? Yeah, do Kingsland's. As long as it's not hurting in the joint regions, I'm evaluating how far the leg drops. So how do you know it's psoas and not rectus femoris? Like, if we do Gainsland's and it seems like this leg's just not dropping at all, how do we know it's psoas?
Straighten the bottom of the leg.
No, rectus femoris crosses the hip,
Yeah.
so it could be rectus femoris.
Straighten the bottom of the leg.
Yes, but we don't do it that way.
Okay.
What we do is, we look at the knee, and if the hip's not dropping into extension and the knee isn't dropping into flexion, it's probably rectus femoris. But you could extend the kney and see if it drops
That's
more.
what I was thinking.
I mean,
Probably
that makes
cumbersome.
sense, but we end up not doing it that way.
Okay.
So, if the hip's not dropping into extension, and the knee is stuck in kind of an extended type of position, it's not actually flexing, we'd probably be thinking more rectus femoris. So these are just things, none of this is really hard, but it's something that a lot of people don't do when they're hyper-focused on one thing. And for a while, back in the 90s and early 2000s, all the massage therapists, the good ones out there, were just like, oh, psoas. There was an article in the Massage magazine, the title was "So As the World Turns."
Oh my God.
But it was really